Italy's experience with the coronavirus went from bad to worse very quickly. Now, in the second week of a nationwide lockdown, Italians are facing some of the worst of what this pandemic can bring. With us on how the government and the people are doing in the face of this thing, we welcome, via Skype from Toronto, Francesca Lamarca. She is a Canadian who is an MP in Italy's parliament, representing Italian citizens in North and Central America. And with us via Skype from Rome, Italy, Ercole Rocchetti, reporter and documentary filmmaker with RAI, the national public broadcaster in Italy, and also via FaceTime from Rome, Eric Reguly, European bureau chief for the Globe and Mail, and we are delighted to say buonasera a tutti. We're glad that you could all make some time for us tonight on TVO, and I do want to start with our friends in Italy because I think, Ercole, start us off. I don't think we can yet imagine what it must be like for all of you to be essentially in complete isolation and under virtual house arrest for the last week. How is your sanity doing at the moment?
Well, it's something really unbelievable, something that my generation, but also maybe older people than me, are not used to because we didn't live the war, but older people told me that it's the same situation that my grandfather were living during the war. I mean, we are isolated. My children are at home. They are doing school by distance on the webcam with the teacher, and we can go just for a while outside with a surgical mask. We are very, very scared that can happen something to our parents, to our grandparents. And but we are also worried for the children. We don't know exactly why Italy has been the epicenter, the focus at the moment in Europe of this pandemic, but we are wondering why, the reason. And even me, that I'm a reporter of a TV program very well known in Italy called Chi l'ha visto. The program has been suspended because in our lab studio was a guest, a vice minister of health, and he was one of the contagions of coronavirus. So my chief editor is in quarantine. I was not there. I just gave my feature, and I didn't enter RAI, but I'm in quarantine actually as well. I mean, we are working through Skype. It's something really that we couldn't imagine. And the drama is not all just for the coronavirus, but for the economy in Italy.
Well, we'll get to that in a second. Yes, hold off on that for a second, Ercole. We'll get to the economic impact of all of this in a second. But Eric, I wonder if you could pick up the story and just talk to us about how restricted people's travel is. Is there a curfew? Are they allowed to be on the streets? What happens if they're on the streets after a certain period of time? Fill us in on that.
It's almost a total quarantine, Steve. There is no curfew. In effect, it's around-the-clock curfew. You can actually leave the house for essential services only. This is only for medicines and to go to the supermarket. But when you do so, you have to carry it's an official government declaration saying that you're out for an essential service. You just can't go and stroll around. I'm a biker. I can't bike around. So it's like living in a prison. It's very stressful. When you do go out in a supermarket, you got to line up, and they allow only a few people in at a time. There's tape on the floor to mark distances from other shoppers. And, you know, we're entering our second week now, and this could go on for, I don't know, another 3-4 weeks. This is our big fear. It could go on forever.
Francesca, you, of course, are one of those most interesting situations where you're one of 12 people who are elected outside of Italy but serve in the Italian parliament and represent the Italian diaspora around the world. We care about this story, of course, because if Toronto were a city in Italy, it would be one of the biggest cities in all of Italy, probably 5th or 6th biggest, something like that. We have more than 500,000 Italian Canadians in the greater Toronto area. So tell me, what is your job at this moment where you have people here who have family back there and are probably calling on you to get information and help for them?
That's very true, Steve. The most pressing issue at the moment is having Italian Canadians and Italian Americans stuck in Italy trying to get back. So these are Italian citizens who reside in North America and find themselves stuck for whatever reason, various circumstances, unusual circumstances, unable to get back. I have a lady whose father passed away and had to rush to Italy for his funeral and has her husband dying of cancer in Montreal. That's just one case that I'm dealing with. So there's a lot of damage control at the moment in trying to contain it as much as possible and to address my constituents' needs.
For a follow-up on that, if you would, with this, I just got a text recently from somebody who lives here, but who has relatives, I think it's an uncle, who lives in Italy, and the uncle's neighbor died, but no funeral is being permitted right now. Is that right?
That's correct. No funerals are being, of course, the burial takes place, but there's no public funeral taking place exactly for the reason that Eric stated, because people are in a state of quarantine and they're trying to reduce social contact as much as possible. So that is correct.
We're going to bring a graphic up here right now to show that, while yes, everybody knows this thing did start in China, and China had the explosive increases off the top, the country that has had the second most difficulty dealing with this in the world is, in fact, Italy, followed closely by Iran and Spain. And we keep hearing that we have to break the back of this thing. We have to break the curve, and the curve is exactly what you see in that graphic. And for those who are listening on podcast and who can't see it, we see cases spiking up in China and Italy over the 25,000 mark in a relatively brief space of time. And obviously, health authorities around the world are trying to flatten the curve here. And Eric, maybe I can get you to pick up on that part of the story. Why did Italy suffer such a dramatic uptake in cases and deaths, unlike so many other westernized countries in the world?
I mean, the numbers are horrendous. As of now, just an hour ago, it's 2,500 deaths and more than 30,000 cases. So it's getting up there. It's number 2 in the world. Italy is doing a good job now, Steve, but they made 2 fundamental mistakes at the beginning. So we're talking about mid-February. The first mistake is the patient, paziente uno, patient number 1, as they call him, was not detected early. He went in and out of the hospital in a little town just south of Milan 3 times without being detected with COVID-19. He went in again and they detected it, and he was in the hospital for 36 hours spreading this disease all over the place. And it just got out of control. The second mistake was when the quarantine came down in the north. Giuseppe Conte, the prime minister, announced the quarantine first in the north, all of the north, after these small towns were isolated. So everyone in the north who didn't live in the north and wanted to get out just streamed south and spreading this disease south. It's not as bad in the south as it is in the north, but it's getting there. And he should have just, instead of doing staged isolation, staged quarantines, they should have shut the whole country down immediately.
Ercole, can you tell us right now what your view is of how much confidence the average Italian citizen has in his or her government and public health officials to get this right now?
Well, we think it's a due. What we are doing, the sacrifice we are doing, is necessary. So nobody is facing this tragedy, this drama, without hope. But the problem is, although the sacrifice also the government is doing for keeping the jobs still the employees and the factory to let them survive, we don't think that this impact will be survived after 3 or 4 months. So the measures they are doing right now are important because you know that Italy has one of the best health care in the world. But what we are doing is we are trying to delay the peak so that not too many people are recovered in the hospital right now, because we are not able to take care of everybody. So most of the people infected has no symptoms, so they stay at home in quarantine. and there are a big percentile of the contagions that are in the hospital, and the situation is getting really serious because we don't know when the peak is going to arrive. So in Rome, there were not many cases comparing with north of Italy. We saw that the model in Codogno, this small town where there was a patient one, the model we tried to follow, it was good because they all stayed like in China, like in one at home. Nobody was going out, and this allowed to avoid other contagions. So no other people were infected. There were zero new patients in the hospital. So we think this is important. The problem is that many people, especially the young people, don't understand the situation we are living. So even from my house, I see sometimes people that is doing jogging, children playing in the grounds. There are very few people because now people starting getting very scared. We have fear.
Maybe I can get Eric to pick up
not
on that part of the story there. Eric, you've got a situation in Italy where you've got 2, sometimes 3 generations living all in the same house. How has that exacerbated this problem?
Well, hugely, Steve. And this is, when the question is, how do you explain this explosion in contagion in Italy? And part of it's economic. The Italian economy is in terrible shape. What does that mean? There's high unemployment. The youth unemployment rate here is 30%. So what happens in Italy? Most young people, by young I mean anyone or under 30, they live with their parents. Something like 60% of young people live with their parents, who may in turn be living with their grandparents. So what you have here is intergenerational contagion, and that's one of the reasons why the cases are going up. Now, if these young people had jobs, they probably wouldn't be living at home.
Francesca, let me ask a bit of a political question to you, and again, it gets back to the confidence people either do or do not have in their leaders at the moment. Your party is sort of the junior partner in a coalition government right now. The government has come under significant criticism for the way it has responded to this. How much confidence do you think there is out there right now among the Italian people, in their public health officials, and in their government?
I think there's a tremendous amount of recognition of the work that frontline workers are doing and the way our government has responded. We know that the EU has complimented Italy on its quick response. 2 weeks ago at this time, I was still in Italy, and many of us were criticizing the government's decision. Actually, it was the Five Star Movement's decision to shut down schools. We thought at the time, 2 weeks ago, that it was a bit extreme. I myself was skeptical of that decision, but hindsight is 2020, and we recognize now that Prime Minister Conte took swift action. Contrary to what Eric says, I believe that the decisions were made quickly. The decisions were made properly. Well, they were all the right decisions to make. As I said, I myself was skeptical of those decisions. I wish that Canada had learned, as I said, when I arrived about 12 days ago, no one really seemed to care here in Canada. And I wish that we had heeded Italy's warning. I think that in response to your question, Italians recognize the efforts of the government. I think that the large majority of people are cooperating with government's demands and are following the rules. And so there is a tremendous amount of recognition of the work that's been done by doctors, nurses, frontline workers. Absolutely.
Eric, do you want to come back on that?
Yeah, I mean, and I have to disagree partly to what Francesca said. I mean, at first, the Italian government was too slow. Now, I'd fully agree with her that they're doing the right things. But look at the numbers speak for themselves. It's the second highest in the world, and we're getting 3,000 new cases every day. I think the country to look at is South Korea. South Korea's population is 50 million. Italy's is 60 million. So, I mean, not much difference. They have 80 cases there, 80 deaths. We've got 2,500. What do? It's different. Well, they did testing right off the bat. They isolated right off the bat. They didn't have a total quarantine like Italy, but they found the first cases really, really fast. and got those people isolated so they didn't get clusters. I totally agree Italy is doing the right thing now, but it did not a month ago.
Francesca, maybe could I get you to speak as well to the notion that the healthcare system and the hospitals in particular are facing a kind of stress level on them right now and a demand for services the likes of which the country hasn't seen since World War II. Is the country up for that kind of, for lack of a better expression, huge demand on its finite resources?
That is absolutely true. You know, we are also quick to criticize Italy and Italians for not coming together, but we can see the very opposite is true, that Italians come together and perform when there is a crisis, as they're doing right now. And there's no doubt about it, this is a huge crisis for Italy, indeed the world. Just last week, and actually just yesterday, last night, the Prime Minister signed a decree, a very important decree, which is called Cure Italy. They've called it Cure Italy. And so Italy is, they're going to be spending 25 billion euros. 25 billion euros have been allotted, have already been, will be used to meet this crisis. So X billion euros will be going to healthcare workers, people in airports, money is going everywhere, and it's going to be used immediately as of today. There's no doubt that this is a strain on the healthcare system. Already, Italy is known for unfortunately, for its deficit. And so we're adding 25 billion euros to the deficit. And that's why more than ever, we need the support of the ECB, the European Central Bank, the support of the European Union, to pull through, to help Italy in this very difficult time. But Italy is prepared to do that because times of need call for extreme measures, and that's exactly what's taking place.
Well, Eric, let me follow up with you on that angle, and that is one of the things we hear public health officials in Canada and in Ontario in particular say all the time is we don't want to get ourselves into a situation where Italian doctors and healthcare professionals now find themselves, which is essentially saying we're triaging life and death. We can't help that person. They're going to die. We only have a finite amount of resources. We're going to help this younger person here. Can you give us a sense about what that triage situation is like in Italy right now?
Well, it's so far it's isolated to the north, where the hospitals are completely overwhelmed. They're running. I was reading today. They're running short of ventilators. There's a factory in Bologna that's actually brought in the army to make sure this ventilator factory works 24/7 to quadruple production. So in the north, they are triaging. The fatality rate among the 70 to 90-year-olds is horrendous. And so they're having to make these life and death decisions. I read a really sad story the other day in Euronews how doctors are pleading for iPads. Why? So that they can give the iPads to the patients who are about to die so they can record their last messages to their loved ones.
Ercole, I need to ask you about what all of this is doing to Italy's sense of itself. I don't have to tell you, this is a very proud, a very wonderful, important country in the world.
Yeah,
but this must affect people's faith in themselves a bit. You tell us.
Yes, the good side of this tragedy is that Italy is recovering the sense of belonging, the national pride. We always think that the Italian is a people, but not a nation. And now you are seeing something that it's really incredible. People is singing from the balcony, even where I live, where it's a very crowded place. I saw people singing on or playing a guitar from the window, and that's something really emotional. And we see flags of Italian flags outside of the windows, and there is a sentence we always say that is "Ce la faremo." We will do it. So Italy, I'm sure that will survive even this time, and maybe we will be better than before. But I want to say something. Okay, Italy is now the epicenter. We have more cases. But the problem is that this is not an Italian pandemic. This is a global pandemic. And Europe abandoned Italy completely. Many people in the world treat Italy like a a place of plague, but it's not like that. This virus, we know everybody that didn't start in Italy, but came from China. But it's not important where did it start. The problem is that this virus regard everybody in the world, not just Italy. So we don't understand why there's been this campaign against Italy, against the Italian products. You know, I'm reading something because the story is important to read. When there was the first war, there was the Spanish influence. You know why it's called Spanish influence? Because all of the countries during the first war were saying that this pandemic was just in Spain. Actually, was coming from the United States or from France. We still don't know, maybe from China. But the point is that they were blaming the poorest country in that time was Spain, to say that the problem was not in their own country, but was outside. The same thing is doing many other countries. Now, the Italian model is being followed by other countries, because Spain has almost the same cases as Italy. It's like Italy 1 week ago. England is not doing nothing at the moment against this coronavirus. You know the politician of Boris Johnson about this pandemic, so they're just waiting. Many people will die because they are not able to take care of a million of UK citizens. So we are doing the best with our means that are not much, but we are doing the best. So we would like to be together, because Europe demonstrate in this case to be just a European community for economy, but not a union. That's the point, because Germany, for example, didn't want to give the surgical mask to the other country. They just were keeping for themselves. So that's not fair that Europe, it's called Europe just when you have to pay the taxes to the other countries.
I understand. Let me get Francesca Lamarca to respond to that. Do you feel as if Italy has been abandoned by the European community?
Yes, I do feel that Italy has been abandoned by the European community. I mean, look, we just have to see the comments that ECB, European Central Bank President Christine Lagarde, gave last week. The comments that she made caused sell-off of Italian bonds. I mean, we know that the value of Italian bonds plummeted more than they had in a decade. So I think that was a quite reckless statement to make. There was no forethought in that statement that she made. She has since retracted that statement. We don't see support coming from other EU nations. I think that certainly more needs to be done to support Italy. If I may add, you know, we were talking about testing, and the other panelists mentioned the wonderful job that South Korea is doing. Well, I'd like to add to that by saying that I wish, my hope would be that Canada follow suit and follow Italy, Australia, and South Korea's example. The difference between Italy and Canada is this, that while Italy is testing anyone who asks to be tested against the coronavirus is being granted a test. Now, we know that Italy's resources are limited. They're willing to increase the deficit by 25 billion euros. That's euros and not dollars. So this tremendous effort is being made, and no one is denied a test kit. Whereas in Canada, I can say, besides the fact that when I arrived 12 days ago, I wasn't asked a single question by the customs officer. I wasn't asked from where I was coming from, although I was coming from a so-called hot zone. And a family member of mine was actually denied a test. Went to the hospital, went to ER, presented with symptoms, had been in contact with me, and was denied a test. And so I find that extremely frustrating. If there's one criticism I have for Canada, it's please allow anyone who asks to be tested to get tested and heed Italy's warning. As Eric said, Canada is now where Italy was maybe 3 weeks ago.
Well, I can tell you the Prime Minister of Canada has already come out and said, and the Ontario Health Minister, Christine Elliott, has reiterated it, that we simply don't have the infrastructure to test anybody who wants a test right now. And they have urged Canadians, if you're not feeling any symptoms, if you feel fine, don't go get tested, because we just can't handle it right now. But Eric, I do want to follow up with you on this issue of what Italy is going through right now and the impact that is having not just on the finances of Italy, but on the Eurozone as a whole? What are you seeing?
Well, that's a big question now. You got to remember that Italy was probably in recession even before anyone heard of the term COVID-19. It's been in and out of recession at least 3 times since the 2008 financial crisis. It almost took a bailout in 2011, 2012. I think that if Italy does not get help unless there's a lot of spending here, which Italy can't afford. Francesca mentions 25 billion. That's a lot by Italian standards. But look at the Germans. The Germans are thinking of spending 500 to 700 billion. Britain tonight announced a package of several £100 billion. 25 billion is not a lot for an economy bigger than Italy's. There is going to be pressure now from Matteo Salvini and other populist Eurosceptic leaders to say the EU is not working for us. The euro is not working for us. Let's get out, guys. Let's ditch the euro, take the lira back so we can devalue it and print as much money as we want. I'm somewhat sympathetic to that view. I think that, but if it happens, I'm not saying it will happen. If Italy were to leave the euro, it would take down the entire Eurozone. This is a really, really big economy still, and it's got a debt to GDP of 135%. It's just crushing debt load.
Fra, you looked like you wanted to respond to that.
I agree. I think that I agree with Eric in this. Certainly, this gives Matteo Salvini ammunition. I think we can all anticipate the outcome of, following this coronavirus crisis. Once we get over it, we know that this will give the way the EU is behaving toward Italy gives Matteo Salvini ammunition, but I think that most Italians are sensible people, and they recognize that getting out of the EU would mean the collapse of Italy, the collapse of Italian economy, and would be detrimental to the country, which is the 3rd largest economy in Europe.
Ercole, I should get you to speak to that as well. Do you think this crisis could lead to Italy's leaving the euro, or even more, leaving the European Union?
I don't know. Thinking about the behavior of some European leader, that would give the power to the populist politician to say to go out from Europe. But I don't think we can go out from Europe because Italy needs Europe and Europe needs Italy. The problem is that this virus should have been faced by all of us, not just by a single country. So the real problem is that Italy, for example, lives off tourism. We have I think the 13 or 14% of our product come from the tourism, and the tourism has been completely destroyed by this
I know,
pandemic.
we have been shocked by the pictures we've been seeing from Piazza San Marco, Piazza del Popolo. Nobody's in the streets anymore. It's really quite shocking.
No, not really. But the leader in the world, like Booking.com and Expedia, canceled all of, not them, of course, their client, canceled all of this 100% of the reservation of the hotels. So all the people that live, not just the owner of the hotels, but also the restaurants, other people working of tourism, now is without a job. They made investment along these years. They have employees. And one of the measures we really dislike in Italy is the fact that they stop the fire of the employees for 9 weeks. And this is not something that can help economy of Italy, because you guarantee the employees for 9 weeks. You have to help the owner of the hotels, the owner of the restaurants, all the people works in tourism and in other fields that is affected by this coronavirus.
Mm-hmm. We've got a few minutes left here, and I want to see if I can just touch on 2 more things. Eric, somebody suggested I should ask you about your former Italian language teacher and what that teacher taught you about Italian resilience. Can you share that story?
Yeah, that's a good story. So a few years, no, during the crisis, so it'd be like 2009 or 10, when things were really bad in Italy. I mean, atrocious, the deepest recession since World War II. My then Italian instructor, Simona, I asked her, I said, look, Simona, are you afraid? She said, no, not at all. And I said, why? What can be worse than this? She said, things are really bad in the 4th century here. I love that story, and she's totally right. I mean, the point being, Italians are really resilient. They've seen worse. They'll get through this. And I do believe that they will get through this. My question is it going to destroy the economy at the same time? Good chance it will.
Well, is this better or worse than the Visigoths coming over in the 4th century? I'm not sure.
Not sure either.
Not sure. Francesca, talk to us about this. We don't necessarily want to traffic in stereotypes here, but I don't think it's a stereotype to say Italians are renowned around the world for being a brilliantly romantic and cultured people and very tactile, touchy-feely. They wear their emotions on their sleeves. How have they handled, in your view, all of the social distancing and the quarantining and self-isolation that the coronavirus has required?
It's an extremely difficult time. There is no doubt about that. As you said, Steve, yes, it is a stereotype, but it's a correct stereotype. I think it would be difficult for any human being. We are social creatures by nature, but Italians, I think, more so than maybe some others. Italians are extremely sociable and known for that, as you said, for the tactile and being, a gregarious people. It's extremely difficult. I mean, I'm so lucky in a sense that I got out 12 days ago. I came thinking that I had commitments here and throughout North and Central America. Of course, those events got canceled, obviously. My heart bleeds for people in Italy. As I said, I'm not there now, but I'm following every minute through the news, social media, phone calls, and I see that it's tremendously difficult for our seniors. Italy is the country in Europe with the highest number of senior citizens, lowest birth rate. Many seniors who are really struggling with this, who don't have that constant contact with their children and their grandchildren, the contact that they're used to. Young people are finding it extremely difficult as well. I mean, the things that I'm reading on social media and from phone calls and FaceTime, for people to be cooped up in their homes is just incredible. I think people are kind of losing their minds. I don't want to joke about it, but I am seriously concerned, obviously, about the economy, the economic impact that this crisis is having and will have, but on the psychological impact, because there is no way that we can come out of this as we were before. The psychological and emotional impact is huge, not being able to hug one another, touch one another, and I'm seriously concerned about that.
Can we say grazie mille to the three of you for coming on to TVO tonight? Francesca Lamarca, the MP in Italy's parliament who represents Italian citizens in North and Central America. She was joining us on Skype from Etobicoke today. Eric Reguly, the European bureau chief for the Globe and Mail, and Ercole Rocchetti, reporter, documentary filmmaker for RAI, the national public broadcaster in Italia. What does one say but bella fortuna, and speriamo that things are going to get better in the future. Avanti.
Grazie, buona serata.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.